Welcome. Thanks for joining us. We're going to give folks some time to join, and then we'll get the conversation started. I'm really excited about the guest that we have on today. This will be an amazing conversation and an important one. Good evening. Thanks for joining us.
Evening.
How are you?
I'm good.
It's so great to have you with us. We are just waiting for a couple of our other guests.
Okay.
But Dr. Purnell, it is great to see you.
Good to be seen, as my granny would say. Very glad to be here.
Let me see. Let me search for our other folks. Thank you, everyone, for joining us. We'll be starting shortly. Okay. Oh, look. Dr. Purnell, looks like you've got some love in the chat already.
Hey! Ya squad, family.
I know this is a really important conversation.
Definitely.
Okay, let me send invites, see if we can get some of our other guests on. Thank you all for joining us. And we look forward to hearing from you. I mean, I have a lot of questions for our guests, but we want to hear from you because this is a topic that has been on so many folks' minds and something that we at the League definitely see as a social justice issue and an equity issue.
Definitely.
One of the things that my team has been working on is actually, let me back up, and I will get the conversation started with you, Dr. Purnell. Good evening, everyone. I am Jericho Richardson. I'm the Senior Vice President for Equitable Justice and Strategic Initiatives at the National Urban League. And I'm the host of our conversation series called Justice Now, because we think it's really important that we talk about a lot of the social justice issues that our communities are grappling with. And health equity is absolutely one of them.
Definitely.
And I am joined here today by Dr. Chris Purnell, who is at University Hospital in Newark, New Jersey. And Dr. Purnell, you're the first, let me get this right, Chief Strategic Integration and Health Equity Officer in the hospital's history.
Yes.
Tell me a little bit about that role and your work and what you're doing.
Definitely. So I've been in this role now for almost 2 years, and it is a life come full circle moment. Newark is the bedrock of my family story in New Jersey as they migrated north from the south, as so many other African Americans did. And to be in that beloved place and a part of that beloved community in this capacity really is an opportunity under Dr. Elna Hall's leadership to have an office that has oversight over community affairs, has oversight over community and population health, has oversight over strategic planning, the patient and human experience, and built for the organization for the first time a credible, effective, and robust health equity strategy, and more broadly, an equity and inclusion strategy, incorporating and integrating equity across all business units.
Wow. So you are managing a lot, and I think it's so important to be able to have you in that role. And I look forward to hearing a little bit more about how all of that comes together with our topic, COVID,
Definitely.
shortly. I want to say hello to Superintendent Millard House, who is the superintendent of the Independent Houston School District, or the Houston Independent School District. Superintendent House, thank you so much for joining us.
Absolutely. It's my pleasure. Glad to be here.
We are happy to have you. I think that the topic that we really want to discuss is one that has been on everyone's mind. We're talking about COVID, but we're talking about COVID now in the year 2021, after we've learned a lot more about COVID, after we've come up with, developed some vaccines, but we are still seeing disparity in, tragically, our community continuing to be impacted by this. And we're talking about it from the framework and the standpoint of school, because we know we have so many young people across the country that are heading back to school. We're talking to parents who have seen the gap and sometimes the decline and difference in our young people and their socialization and their ability to perform, because so many of them have had to engage online and work remotely. So, Superintendent House, I would love to hear a little bit from you about your work in Houston and how you have been approaching this challenge of COVID-19.
Sure. Glad to do so. As you may know, Houston is the largest school district in the state of Texas at about 197,000 students, and the seventh largest school district in the country. So it's a monumental task to ensure that we, number one, develop a plan to ensure that we have a safe re-engagement of students, because many of our students have not been engaged in public education in 18 months. 60% of the students in Houston have not seen a classroom in that time period. So making sure that their families feel safe, making sure that we don't just focus on the academic side, because it's so important for our students to know that we care and that we examine what's between their ears as well. The social and emotional well-being of our children is something that we're really focusing our efforts on, because the pandemic has been traumatic in many instances for not only our students, but our parents. So we've developed quite a few wraparound services, not only for students, but for entire families as a part of our COVID relief strategy. So we developed something called our Ready, Set, Go plan, and it was a plan that breaks down exactly what happens when you have a positive case in a building. We've developed a dashboard that is as transparent as possible, that shares with our community how many cases we have, what schools that case might be coming from, quarantining, and what that looks like in terms of virtual learning for those that might have immune compromised systems as well. So we've really tried to think through this as well as possible. One thing that you're seeing across America that's been a major struggle in public education is bringing all of our kids back. And then the second thing is the vaccine hesitation that we've seen with many families as well. As I mentioned earlier, we're a school district of 197,000 students, but we've only seen 185,000 show up. So we're still pushing the envelope to ensure that our children and our families know that we're the safest option for them to be in right now, and that we need them back to support them socially and emotionally and academically. So it's been a monumental task, but we're up for it in HISD and looking forward to having a wonderful school year.
Thank you for that, Superintendent House. And I think having a plan is so important and critical at this time, because there are so many questions out there, and rightly concern from parents, from community members, and from everyday people. I am happy to see that we have been joined by Dr. Stella Sappho. Dr. Sappho is an entrepreneur, an innovator, and just a dynamic Black woman who is working in this space and in this field. And she's currently the founder of Just Equity for Health. And I just want to say welcome to you, Dr. Sappho. And why don't we jump in and talk a little bit about vaccine hesitancy as Superintendent House raised. Can you tell us a little bit about your work and what you do, and then just kind of open our conversation up a little bit more about vaccine hesitancy and what's driving it from your perspective?
Absolutely. Thank you guys for having me. And it's great to be joined by colleagues and by the folks who've joined to really have this conversation. And I think I want to normalize the feelings people have around being confused with the vaccine. Being confused with COVID, period. We said, don't wear masks, then we said wear masks. We said COVID would be done in a year. We're going on to 2 years. We said the vaccines will make sure that you never transmit COVID, and now we're kind of saying that that's not the case. We said stop wearing masks in May, and now we're saying mask mandates have to come back. So if you feel overwhelmed and not clear, that is okay. But I also want to say that part of the reason why there isn't kind of a set playbook that we're working from is because COVID is a new pandemic. I don't know if any of you guys are over 100 years old, but none of us have ever been in a pandemic. We've never been in a pandemic with this political environment, with this global environment, and with the interconnectedness of the world. And so COVID is teaching us a lot. And what we are trying to do, I'm an HIV primary care doctor and a public health practitioner. What I'm trying to do is make sure that our communities, especially our Black and Brown communities, have all the information that they need to have. So I just want to start off by saying that if you have questions about COVID and questions about the vaccine and you're confused, it's okay. But it's really important that you're engaging with individuals who want to bring you the right information. And from my perspective, myself and others have just been out in the community, educating people with what we do know and answering the questions where if we don't know something, we can be really honest. And so my hope is that tonight we can talk about some of the specifics around the vaccines and give our caregivers and parents a sense of confidence as you head back into the school year.
Thank you for that. And so if we're talking about specifics and the vaccine and the ability to give folks confidence, I would love to turn it to you, Dr. Purnell, because you actually participated in the trials. Can you talk a little bit about that and what that experience was like for you and why you felt it was important to engage?
Certainly. So I began tonight talking about the role that I inhabit at University Hospital. So I just want us to all take a moment and to rewind where we were in March and April of 2020. Being our state in New Jersey, our state's only public academic health center, we had actually been in a pandemic preparedness stage for quite a couple of months before we actually got our first case. And then by time we got into March and definitely in the beginning weeks of April, we see our hospital overfilled. I don't want to say filled, but overfilled beyond capacity with Black and Brown folks. Newark is a majority African American, Black, and Latino Hispanic city. So we see patients sick in every hospital bed. And I don't just see this when I show up at work, but I see this in my family. I lost my father to coronavirus. I lost my father on April 13th, 2020. So while working in one hospital, my father is dying in another hospital 4 miles away from me. And I will never forget that day. And as a nation, I don't want us to ever lose sight of the souls, of the names and the faces of those whom we've lost to this pandemic and continue to lose. And so ultimately at the hospital, we were losing patients, we had lost staff persons, and then I lost my dad. And I needed a way to demonstrate accountability and to sow my father's legacy forward. Just to piggyback on what my colleague had said, my father was a Black man who had overcome so many things. He'd overcome the Jim Crow South. He had overcome a chronic HIV/AIDS infection. And here his life was snuffed out by coronavirus. And so I needed a way to pay forward that legacy and demonstrate accountability to my community that was being disproportionately devastated by this pandemic because of the issues that are commiserate with systemic racism. And so I decided to enroll. That was a very deliberate choice and decision, but I thought it would be able to give me an insider view that I could have that conversation with the community to say these trials were done in a safe and ethical manner. These trials followed and upheld informed consent. These trials were voluntary, and that these trials had the participation of folks who looked like you, not only participated in it, but we had principal investigators or site leaders who were from the communities that our patients come from. So that's a portion of why this was just so important for me to put my life on the line and to put my profession on the line and to be a part of the solution.
Yes.
Thank you so much. I wanted to make sure you all did not hear the noisy New York situation down there, but thank you for that. My apologies. So what I said earlier was I just wanted to say I'm so sorry for your loss, Dr. Purnell, and I just wanted to say thank you for really standing up and engaging and being part of this trials. I absolutely think it was important, and you have had an impact on our community. And I think it's really important for folks to see doctors of color and understand their commitment and investment in this work. And if we're talking about the Moderna
Definitely.
vaccine, it was, you
Yeah.
know, it was created by a Black woman. And so I know we've had a history in this country where that has led many in our community to be hesitant, to be skeptical about anything in the health space, about, you know, edicts that are coming from the government. But I also think it's important for us to have this conversation and focus on education because there's so much misinformation out there. If you look at social media, you will see a lot of, I think, a lot of interesting conversations, and there are conversations from anti-vaxxers and folks that are vaccine hesitant, where they're sharing a lot of information that in some cases is legitimate, but it's also coupled with information about the vaccine that is inaccurate. And I think it's causing a lot of confusion in our communities. And I think it is resulting in this second wave that we're seeing with the Delta variant. You know, we had a lot of loss in our community, but then there are some folks that were not touched personally by COVID-19. And this is just my hypothesis. It may not be accurate, but I think because they were either not touched in a dramatically difficult way where they lost someone in their family or someone close to them, or they got COVID and, you know, they had maybe mild, you know, symptoms, just are not seeing the second surge and the second wave, or even the first one that we saw, as really a priority. And it is really showing up in the decisions we're making or that are being made politically across the country. It's showing up. We're just not aligned. It's showing up in schools, and whether you have teachers that move forward and get vaccinated to protect so many of our young children that are under age 12 that don't have the ability to do so. And so we're just kind of in a very disconnected place. And so while I see the comments in the chat about we're in a pandemic and we need to shut it down, I think it's important to take what we've learned so far. And I think a lot of the things we've learned is there is a way that we can move and live life in this pandemic in a safer way because of the information that we learned, because of the vaccine, and because of masking. And so that's why I'm talking about school, and I'm bringing up school because we have a very vulnerable population of young children that don't have access to the vaccine now. And we need to do what we can to keep them safe, but also make sure that we're not causing even more harm on them mentally because they're unable to engage and connect. So Superintendent House, can you talk a little bit about, you talked about your plan, but I want to talk a little bit about political courage, because you're in a state like Texas, like Florida and Arkansas and others, where we see the number of cases just skyrocketing. And so you have literally had to be on the front lines with trying to, you know, educate our children and reconnect them with the world and society and continue to keep growing and learning. But you've also had to grapple with, you know, the political concerns around you, and not necessarily being in a state where masking is mandated in the way that it is in other jurisdictions. Can you talk about that experience and why you felt masking was important and what steps you took to protect your kids?
So there has been a push politically, unfortunately, to not allow school districts and superintendents to make those decisions. But what we've decided to do in Houston is to simply let the data drive our decisions. And what the data told us is that we had a 500% increase in hospitalizations in a very short period of time. We went from a 4% community spread in July to a 21% community spread. So we took the stance that we had to protect our students, we had to protect our staff, and we've been had to actually go to court in reference to what's going on around this mask order. We have a temporary stay right now via the Supreme Court that allows for us to move forward and have the mask order. So we think it's right. We talked also about the hesitancy that's still out there in terms of vaccinations. And so we've decided to pay a stipend to our employees, regardless of whether they have already had the vaccination or been vaccinated or not, or whether they're going to get it. We'll pay them a stipend to do so. Again, we have 27,000 employees, 197,000 students. It's very important. We're one of the largest entities in the city of Houston and in the state, so it's important for us to lead the way. Since we moved forward and mandated masks, several school districts followed and did so. And we even, had a simulation that was done around what a mask order would look like in a school district like ours that required, and what it would look like if it were not required. And that simulation really provided some data that let us know that what we're doing is the right thing. So we'll continue with this stance and make sure that we're doing what's safe and what's best for kids and employees.
Thank you for that. And so talking about data and what we've learned over the past year or so, Dr. Sappho, I see some comments in the chat that say masks don't work, especially not for kids. I would love it if you can speak to that. And I would also like you to address herd immunity. I think we see the constant conversations on TV, and we hear a certain percentage coming out from the White House about where we need to get to be in a better place than where we are now. So I would love for you to touch on masks and then move to herd immunity and what that really means.
So I appreciate the comments about, questions around masks. I want to just ask you guys to consider something, which is, if you believe that COVID is real, which I hope many people do, when people get sick with COVID and they go to the hospital, they're very infectious. They're coughing, they're sick. And in that setting, healthcare workers are taking care of them. They're actually opening up their mouth, putting a tube down their throat, intubating them, and then getting them to the ICU. And if masks didn't work, if you believe in COVID and you believe that masks didn't work, then what you would be saying is that all those healthcare workers who've ever taken care of a COVID patient should be sick, right? Because they're around the sickest patients and they should get those particulates on them. So we know, we now have so much evidence that has shown us that masks absolutely work. It matters that you wear them correctly. And in some situations, it matters that you're wearing the right kind of mask that's fitted well to your face. For the comment that children have a really hard time wearing masks or maybe don't wear them well, sure, if you have a mask on, but you're wearing it under your nose, or you take it off most of the time to talk to someone, it's not going to work in the way that it needs to. And of course, kids may have a hard time keeping it on their face. But I have to say, we have to kind of accept some basic facts. And one of those facts that we have now is that we know that social distancing helped us. We know that masks absolutely help. We know that the vaccines can save lives. And I feel like if you start from there, you can pick and choose kind of what you want to really invest in. I would suggest using a combination of all of those strategies. For the idea of herd immunity, what we had hoped would happen is at the time where we had a less infectious strain of COVID, so COVID that was spreading to just 2 people if you got it, we were hoping that what we could do is vaccinate enough people. And what we saw at that time is that if you were vaccinated against these original strains of COVID, that essentially you weren't good at transmitting the virus at that time. And we had hoped that we would get enough people vaccinated. The estimates are over 80 to 90% of folks vaccinated. We'd bring the community rate of COVID down. And so we wouldn't have a lot of COVID being transmitted. And even if you got COVID, it'd be so low. And you wouldn't have a lot of symptoms, and we would get COVID under control. The reason why we're not seeing that now is 2 reasons. 1, we don't have enough individuals vaccinated, and 2, COVID has mutated. This is the thing that we've been afraid of, but it's what all viruses do. The HIV virus that I work with, it mutates. That's how viruses survive. And so we now have a more severe form of COVID that is spreading more rapidly and is infecting people at higher rates than we expected. And so we're seeing even people who have been vaccinated getting COVID. What we are not seeing, though, and this is so important because I just did a talk today and someone said, why should I get vaccinated if I'm going to get COVID anyway? You may get COVID, breakthrough COVID if you're not wearing your mask, if you're on someone who's sick. But what won't happen, most likely, is you will not get hospitalized. You will not be so sick that, God forbid, you die. Sign me up for that. That is amazing. So yes, you may still get breakthrough COVID because the community rates are so high, but you will not get sick enough to end up in the hospital. And hopefully you will not be one of those, statistics that ends up in the ICU and dying. And so we're past the point of herd immunity at this point because COVID has mutated and become more severe. And that is why, though, we're asking people still get vaccinated because you can protect yourself from very severe disease.
Thank you for that. Dr. Purnell, do you want to jump in and
Sure.
add to any of this part of the conversation?
No, definitely. I think it's really important for people to understand that protection is never one thing. Protection is multiple layers. And that's true in any aspect of your life. When you want to prevent disaster, when you want to prevent a bad outcome, when you want to prevent something that is unfavorable, you're looking to increase your chances, increase your odds of safety. And too often I hear people saying, well, why should I get vaccinated if there's a chance I could still get infected? Why should I wear the mask if people who are still getting infections of COVID? Because it's a multiplicative effect. It's an additive effect. The more that we do to protect ourselves, the better able we are able to fight against this pandemic. As the doctor was saying, look, COVID is smart. Okay, and COVID is going to continue to try to outsmart us, to outsmart all of our offense and our defense. And COVID is going to continue to mutate as long as there are persons who are unvaccinated. The virus will have an opportunity to change. The virus will have an opportunity to possibly evade some of the current vaccines that we have that are authorized and or approved. So I can't emphasize enough to people doing everything in your power to have the highest level of protection. So for instance, I also have a sister who is a long COVID-19, has had long COVID. And at first, the conversation that I had with her about how important it would be for her to get vaccinated was, okay, so what benefit will it give me if I've already had COVID? It took me almost a year to recover. And to be able to have that conversation and say, look, this is added protection. Yes, reinfection is rare, but there could be a variant that comes around that you don't have as strong or robust immunity against. So again, I just want to emphasize to people that protection is never one thing. Protection is a multiplicity of things. And finally, in the school environment, it is so important that parents, that educators, and that even the children understand we all have to be on the same team. That is the only way that we fight successfully in this pandemic, if we are all on the same team, meaning we're all understanding that if a person can't get vaccinated because they're not eligible by age, how do others protect them? By being vaccinated. How do we protect the group? By social distancing, by cohorting, by contact tracing, by testing, by proper ventilation. So I just want people to understand it's not one thing, it's multiple things.
Well said. I think some of what we've seen in the news this week underscores your point of why it's so important to have the layers of protection. When we saw in California, we had a teacher that was experiencing symptoms but thought it might just be allergies, went to school and removed their mask to read to the children. And then we found that out of the 10 children in the front row, 8 of them ended up getting COVID as a result. And then other children within that classroom in school ended up getting it. So the layered piece is really important. And I don't want to scare people away from going to schools because I think it's really important. But I think the point we have to remind people are for those that are adults that have the ability to get vaccinated. That being vaccinated isn't just, maybe you had COVID, maybe you had a mild case and you feel like you have some level of immunity. It's not just about you. It's about all those around you and those people you love. And I think sometimes that's what gets missed here. It's yes, we do have individual freedoms and individual choices, but we also have to recognize that each of those individual choices that we make not only impacts us, but impacts others in our community. So we've talked a lot, and I wanted to just give you all the opportunity to add parts of the conversation or add some thoughts that we have not talked about and covered, because I think we can talk about COVID, we can talk about our kids for a long time, and I just want to make sure I give you the opportunity to lift up some of the things that are important. And since we're talking, we're looking at this from the National Urban League, we do look at it as an equity and a social justice issue.
Mhm.
If there's anything you all want to speak to about this pandemic that we're in, about the decisions that were being made, about the politics at play, and unpack how that relates to some of the equity and social justice challenges we have, I would love to hear it. So the floor is yours, whoever wants to jump in first.
Sure. I'd like to say something about that. So equity can never be just a reaction to a current state, a reaction to gaps, a reaction to deficits. And I think too often in this pandemic, we found ourselves flat-footed around an equity approach. And what I mean by that is, if we're seeing that the pandemic is disproportionately impacting Black and brown lives, right? If we're seeing that persons who work frontline jobs, not just frontline in healthcare, but frontline across all essential industries. I also lost a cousin who was a Newark postal worker. Okay, so he was on the front line during this pandemic. If we're seeing those communities be disproportionately impacted, we as a society, we as a public health system, we as a government have to think through, how do I protect the most vulnerable? And how do I get interventions through to the most vulnerable? So I wish we would have had a more robust conversation around vaccines before vaccines became available. We knew full well that the science was being worked on and that the science was being developed. And too often, community has felt like we bring up topics as they're happening, or we bring up topics because there's dissatisfaction or because there's pushback. But I want us to have more informed storytelling. Bottom line, tell stories. We in public health need to tell stories about how we arrived here, and stories at how we protect ourselves and how we prevent worse outcomes, and stories around how equity matters, and stories about what future state should be. And if this pandemic did anything, because, we're not seeing one pandemic, we're seeing the collision of multiple pandemics. We're seeing the pandemic of systemic racism, the pandemic of coronavirus, a pandemic of mental health and behavioral health, a pandemic around a host of chronic conditions which have now been neglected or ignored because of lack of health-seeking behavior during the pandemic or lack of access. So we're seeing the collision of so many pandemics that were years in the making, years. So hopefully we will begin to have larger and more informed dialogue around those upstream factors, those structural factors where people live, where people play, where people work, where people pray, where they age, and where they're born, and to say, how do we create place-based approaches, place-based interventions to help people to achieve their highest potential of health and life outcomes?
And the only thing that I would add there is that one of the things that's so helpful about public health, as I'd like to, say to different groups, really is a group project, right? If you do public health well, if you want to be successful, everyone in the group has to participate. And so what happens oftentimes, and I do health system design, is we design our health systems with a few folks in mind who can afford it, who have that good insurance, who can use it. COVID is a perfect place that shows us we cannot leave anyone behind. We have to make sure all of us understand how to protect ourselves. All of us understand why to take the vaccine. All of us understand, what it is that goes into keeping our community safe. And I think it's exactly as Dr. Purnell has said, it really brings up this equity question that historically we haven't had to deal with, and COVID is forcing us to deal with. The one additional thing that I would add is everyone who's here who does really care about this issue, I really encourage you to be a messenger, because we have learned that when it comes to vaccinating, people are not necessarily listening to the TV, the politicians, the people that they're just, hearing from. Maybe they're listening to Facebook and different social media outlets, but they're listening to each other. and they're listening to you. I had so many people who said, Doc, I was waiting to talk to you before I got the COVID vaccine, and now I'm going to go tell my family to get it. What should I tell them? You literally are a vessel who could save someone's life. Every person that gets vaccinated, sure, they may still get COVID down the line. Again, not as likely, but they will definitely be more protected than if they didn't get vaccinated and didn't do all the preventative measures. So I just encourage you, if you're listening today and you're thinking, this is helpful and I want to figure out how to contribute, I would encourage you to pick 2 people who might have a challenge with taking the vaccine and just listen to them. Just hear what their concerns are. All of us are available. We all have public accounts. Feel free to reach out. I'm happy to answer one-on-one questions because, again, every single person that vaccinates is a child that's protected, is an older person that's protected, and themselves, are also protected. So I really want people to walk away with that message.
Yep, and the only thing that I would add is that while we're paying close attention to the physical health of our students and parents across America, it's so important to pay attention to the mental health as well. So many of our kids, as they come back to buildings, have bared the weight of a different lifestyle. And many of our kids are dealing with PTSD, and it's a struggle that we as professionals in the industry have to pay attention to, have to throw resources at, have to ensure that we have the supports in our schools, in our buildings. We've invested quite a bit of money with wraparound services, counselors, several different entities that we're partnering with to ensure that we do what's necessary to support our kids above their shoulders. So I think it's important that we lift this up as parents. We have to recognize, I'm a father of 2, a 16-year-old and a 10-year-old. And I try to pay close attention to where they are, have those conversations with your children, ensure that you know what's going on in their heads. Before they can learn something on a consistent basis, they have to feel good about who they are, where they are, and understanding that their mental health is in a good place.
Thank you so much for that, Superintendent House. It's so important. Our kids have gone through a lot. And when we're talking about equity, we've seen the numbers, we've seen the drop off. We recognize that access to the internet, to digital components is sometimes more challenging for students of color. And we've got to get our kids back, and we've got to make sure that they're connected and that they're getting educated, and we've got to do it in a safe way. I mean, it's a challenge, but I'm so appreciative to be having the conversation with all of you who have really rose to the occasion and are really pushing for our community. We have to wrap soon, but I did want to raise one of the questions that I saw in the chat. Obviously, we've seen and heard about Pfizer being approved. I believe Moderna is probably likely to be next. But when we're talking about our communities and communities of color, we have a high number of immunocompromised people in our communities. And so folks are wondering, some people have done the first dose or the 1 dose, and some people have done the 2 doses. But can we talk quickly about boosters? And what are your recommendations regarding that, especially as it relates to folks in our community that are immunocompromised? Whoever wants to answer the question.
So I talk about this a lot because I have a lot of HIV patients, and so it comes up all the time. The recommendation now is that you can consider the COVID vaccine for folks who are immunocompromised, so those who take medicines that depress your immune system, cancer patients, people with HIV. There's kind of a whole long list that you can consider that the first 2 shots of the vaccine gave you some immunity, but that you need a 3rd shot to really strengthen your immune system all the way. So when people say, well, does that mean that the vaccine didn't work? I want you to think about other vaccines that you may have gotten that require 3 shots, or multiple shots down the line. And this is just something that we do with, vaccinology in general, is we try to understand your immune system, what you're sensitive to, and give you as many shots as you need to strengthen your immune system. So if you have an immunocompromised condition or something that makes your immune system more compromised, at this point today, you can go ahead and get your 3rd booster. The recommendation has also come out, and this is a little bit controversial, but I'll explain kind of the idea behind it, that because Delta is so severe, what we are seeing is that some people who are 8 months out from their original vaccine series, the first two, are a little bit more likely to get COVID if they're exposed to COVID. And so the recommendation is that maybe those individuals should also go ahead and get what is now known as a booster shot. And so I want to just emphasize, though, that for individuals who have gotten their first two shots, even if you get COVID, we are, again, not seeing the numbers of individuals that are getting hospitalized and dying that compare at all to if you're unvaccinated. So it doesn't mean just because there's a recommendation for a third shot, the first two shots didn't work. Because if the first two shots didn't work, we'd be talking about hundreds of thousands of people that have died in the last 3 months. And thankfully, that's not kind of where we are. And so again, if you're immunocompromised, go ahead and get your third shot now. You can talk to your doctor about it. And if you're 8 months out, so that's usually nursing home residents and healthcare workers, you can go ahead and start thinking about getting that booster shot. Dr. Purnell?
Sure. I was just going to add, again, to take people back to that conversation that we were having about prevention. Prevention works through multiple actions. And likewise, vaccines typically work through multiple doses because it's a way to strengthen the immune system to the level that it can take on stronger opponents or take on the opponent that it's designed against and to flatten, right? To be more effective at preventing severe disease. And so I look at the eventuality of boosters as a way of just putting each person and hence the public collectively in the strongest position to fight against the pandemic. I do want people to know, though, as long as we have a significant proportion of our population that is not vaccinated, the pandemic will have a leg up on us. So we're actually in a position of privilege in the United States to be talking about boosters when there are countries where healthcare workers haven't even been fully vaccinated or have initiated a vaccination series. So there is a scale to this. There is some balancing because we're constantly talking about equity. So if you are immunocompromised, yes, you should be having a conversation with your doctor or you should be in the process of getting vaccinated. I fully expect that when the CDC releases its full recommendations, that the priority groups among everyone else will be those who work in jobs where their exposure risk is higher, healthcare workers, those who live in nursing homes, and older Americans, because we were seeing through the data that those persons, particularly nursing home residents, were susceptible to disease from unvaccinated persons. So their immune system needs another kick and another boost.
Thank you for that. So we are going to close out. I would love to give you each the opportunity to share some final words. Looking in the chat, and I see one person saying, I wish I can convince my dad and stepmom to get vaccinated. They are older and immune compromised. So just would love to hear from you. It's been so great to have you all on to talk about this important issue from different vantage points, because I think it's multi-layered and multifaceted, and we have to look at it through so many different lenses. So Superintendent House, I want to turn it over to you for some final words and any other thoughts you want to share with our viewers today.
My father used to always, he was CEO of the Urban League in Tulsa, Oklahoma at one point in his career. And he used to always tell me to reach one and teach one. I think in this time of COVID, it's an opportunity, especially when we talk about the hesitancy in our Black and brown communities, to ensure that we're reaching as many individuals that we can to teach them about what this means for their community, what it means for their family. I too am an individual that lost family members, unfortunately, to COVID. And until that happens to you, it hurts. So please, those of you that are out there, make sure that you're educating. It's not just about self, it's about our community as a whole. It's about our children and ensuring that our children get what they need. We need them back in school. We need the normalcy in our communities that our communities are yearning for. But in order to do that, it is so important that we all reach one and teach one and make certain that we're doing our part.
Well, thank you, Dr. House, for just being on with us today. I think I've learned a lot from you in this conversation. And thank you to your family and your father for his contribution to the movement. You know, once an urban leaguer, always an urban leaguer. So we just appreciate all of the investment that you're really doing into the community, and it's such a rich legacy. Dr. Sappho.
Sure. I mean, I'll keep my closing comments short. I want to congratulate every one of you that has gotten vaccinated. I think you've taken a step to keep yourself safe. I want to remind all of us that there are many ways to keep ourselves protected. And so even if you're vaccinated, please do all the other things. Wear your mask, socially distance, make sure the people in your life who are, more vulnerable to COVID have that extra layer of protection. They're not traveling and they're doing all the things to keep them safe. And I want to just remind us that we're dealing with a pandemic that is only getting smarter and more virulent and more robust as we're going. And so I don't want to see us as Americans and as individuals in this kind of global landscape lose the number of years that we've lost. COVID has taken 1.5 to 3 years off of life expectancy in the US. It has taken, as the superintendent has mentioned, years off of kids' well-being from taking them out of school. We've all lost money from COVID. We've lost our peace of mind. And so I just want to kind of give a personal plea as someone, who takes care of patients. I don't want to see us lose anymore. And I certainly don't want to see our Black and brown communities suffer and continue to suffer disproportionately from COVID. So I just encourage you to think about how you can keep yourself safe and how you can keep others around you safe. And do not be shy to ask the questions. There are so many of us here that would just love to be able to just talk and listen. And we want you to have the information so you can keep yourself safe.
Thank you for that. Dr. Purnell?
So I think I will end with the word power. Power is central to conversations around equity and justice, right? Because power is how resources are distributed. Information is power. Your story is power. Your narrative is power. My father's life and death have afforded me a power that I did not have before. And the ability to pay that power forward is the ability of what we all need to do in this pandemic, to think about the collective, to think about the whole. And then finally, just to think about the power that has been displayed through the discovery and the excellence that has gotten us to the point where we have multiple vaccines either authorized and or approved. And that was also due to Black excellence and Black power. Black and brown persons have been a part of this process at every level, whether in the lab, like Dr. Corbett, or whether a part of the evaluation process at the FDA, or whether like Dr. Sappho and other Black physicians and physician scientists like the National Medical Association that have stepped forward to say, I understand you, I hear you, I know not only your history, but your contemporary battles. So I want to help decipher and translate what's happening. I don't want us to ever lose sight of power, because in us understanding that weave or that narrative of power, ultimately, we're going to get to high ground.
Well, power is key. This has been such a powerful conversation, and it's so meaningful for me to be able to have it with you all. You really are just experts in your field, and it's a recognition when we talk about the vaccine or we talk about COVID, that our people are doing the work. Our people are part of the solution. We've been part of the plan, and they're in decision-making positions. And so it's our responsibility to educate. It's our responsibility to motivate people, to recognize and see that we are part of a collective and that we have a collective responsibility and accountability to prevent additional lives lost really rests on all of us. So thank you so much for joining us today. Thank you to all of the folks that have tuned in. You asked really important questions. Obviously, this is an important topic, and we will probably have another conversation on this down the road. But just thank you for all of your contributions. Thank you for all of your comments and your questions. These are the conversations that we need to have. And when we're talking about equity and we're talking about justice, we are talking about us. So there's still much work that needs to be done. And so let's do the work. So with that, I just want to bid you all farewell for the evening and remind you the time for justice is always now, and that applies to health equity and battling COVID-19 in this pandemic. Thank you all. It's been a pleasure.
Thank you.
Thank you. Be safe, everyone.
Take care.
Take care.